Welcome guys back in my channel. In this video we'll talk about the back pain. After finishing this video you'll understand what are the types of back pain, brief information about back structure, what causes the back pain, excluded the birth defects or congenital disorders, injuries, degenerative problems, nerve and spinal cord problems, and non-spine sources. What are the risks from developing back pain and recommendation for keeping one's back healthy. What's the back pain? The back pain is one of the most common pain happening to people. Back pain can include lower, middle, upper back pain, or maybe low back pain with sciatic nerve. This sciatic nerve and lumbar plexus, this nerve are innervating the pelvic region of the body and the lower extremity, and make muscular problems for lower extremity. Back pain can range from dual constant ache to sudden, sharp, or shooting pain. It can be suddenly as a result of accident or by lifting something heavy, or can be developed by the age, so be careful. There are two types of back pain. Acute or short-term back pain lasts for a few days to a few weeks, no residual losses in function, and it may tend to resolve on its own within a few days with also self-care. And the second one, chronic back pain, is defined as pain that continues for more than 12 weeks, even after initial injury or underlying cases of acute low back pain has been treated. So it doesn't always mean there is a medically serious underlying causes or one that can be easily identified and treated in some cases. The lower back, where the most back pain occurs, including the 5 vertebrae referred from lumbar 1 to lumbar 5 in lumbar region. Intervertebral disc that act like shock absorbers throughout the spinal column to cushion the bones as the body moves. Okay, this is the function of the intervertebral disc. And the ligaments in the spinal column hold the vertebra in place, and tendons attached to the muscles to the spinal column, supporting much of the weight of the upper body. It's the function of the ligament holding the muscles. The intervertebral disc is like cushioning. What can cause lower back pain? Most acute lower back pain is mechanical in nature, meaning there is a disruption in the component of the back. The spine, muscle, intervertebral disc, and nerves fit together and move, or having something to them. Some examples of mechanical causes of low back pain included the birth defect, also known as a congenital disorder. The birth defect may result in disability that may be physical or intellectual or developmental. The second one is injuries. The third one, degenerative problems, nerve and spinal cord problems, and non-spinal cord problems, sources to the spine. The congenital anomalies, they are divided into two. The skeletal irregularities such as scoliosis, a curvature of the spine in the skeletal. The lordosis is abnormal excavated arch in the lower back. The third one is kyphosis, excessive outward of arch of the spine, and other congenital anomalies of the spine. The spinal bifida, which involve the incomplete development of the spinal cord or its protective covering, and can cause problem involving malformation of vertebra and abnormal sensation and even paralysis. Here in this picture we can see the normal human and the human who has the lordosis. Here we can see the excessive excavated arch of the lower back, and the scoliosis has the curvature of in the spine. That's what we can see. And the kyphosis, he has the excessive outward of the spine from its place. This one. Spina bifida, there are some examples of the spina bifida disorders, the occulta or meningococcal or the myelomeningococcal. We will talk about spina bifida and their diseases in details next videos, inshallah. The injuries, there are two types of injuries, the normal and the traumatic injury. The normal injuries are sprains or overstretch of the ligaments, the strains or tears in the tendon or muscles. This picture, the tendons and muscles, tears in. The spasm, sudden contraction of muscle or a group of muscles. The second one, we have the traumatic injury, such as from playing sport, car accident, or fall, that can injure tendons, ligament, or muscle, causing the pain, as well as compress the spine, causing this to rupture or herniate it. The main thing you should know about the traumatic injury, they affecting the ligament, everything, but they compress the spine. Traumatic injury, the herniated disc. Here we can see the intervertebral disc give the nucleus pulses, and these nucleus pulses they compress the spine nerve and give us the feeling of pain. And next example about the cervical vertebra after fractured or car accident or any accident. They fracture the vertebral bone and they compress the spine, give us the feeling and sensation of pain. The degenerative problems, the intervertebral disc degeneration and loses its function ability, which occurs when the usually rubbery disc wear down as normal process of aging and lose their cushion ability. So the degenerative problems are the main things you should know about them. The joints, they losing their cushion ability. The arthritis is an inflammation of the joint. There are more than 100 different types of arthritis with different causes and treatment methods. The two most common types are osteoarthritis and rheumatoid arthritis. Here we can see the arthritis, the inflammation of the joint or the spine, who has the osteoarthritis, which is the common type of the arthritis. The osteoarthritis is decreasing the bone density and narrowing the disc and give us the feeling of pain. Nerve and spinal cord problems. There are many types of problems. We will talk about some of them. First one, we have the spinal nerve compressing, inflammation or injury. This disease is called the sciatica, caused by something pressing the sciatic nerve that innervate the quads and the back of the leg. Which people who has the sciatica will feel pain in the low back and will feel pain also in the part and down back of the leg. The second one, we have the spinal stenosis, the narrowing of the spinal column that puts pressure on the spinal cord and nerves. So that's why if you feel pain, maybe it's the sciatica or spinal stenosis. So that's why we should go to the specialist doctor. The third one, we have the spondylolisthesis, which happens when the vertebra of the lower spine slips out of the place, pincing the nerve, exciting the spinal column. In this picture we can see, sorry for this one. Here we can see the sciatica, this is the sacrum, and the sciatic nerve that innervating the spot and back of the leg. So people who have sciatica, they will feel pain in this region, lower back of the region, and the part and the back of the leg. Here we can see the compressing of the spinal cord, just for the sciatic nerve. If he has this condition called the herniated disc, maybe it's affect in the cervical, maybe it's affecting the sacrum. So if they affect to the sciatic nerve, they will call the sciatica. The cervical spinal stenosis, the normal spinal canal, you can see it, and this one who has the spinal stenosis here, we can see the narrowing of the spinal canal and compressing of the spinal cord. Number 4, we have herniated or ruptured disc can occur when the intervertebral disc become compressed and pulled outward. The fifth one, we have the infection involving the vertebra or the intervertebral disc or the sacroiliac joints. The sixth one, we have the cauda equina syndrome, occurs when a ruptured disc push into the spinal canal and press on the bundle of the lumbar and sacral nerve roots. The seventh one, we have the osteoporosis, a progressive decreasing in bone density and strength that can lead to painful fracture of the vertebra. The non-spine sources, we have some people or patients have pain in their back, so they will say we have problems in our spinal cord. No, not all the pain in the back. They say the problem in the spinal cord or the vertebra. Maybe it has kidney stone or endometriosis or fibromyalgia or tumors. So we'll talk about them. The kidney stone can cause sharp pain in the lower back, usually on one side. Okay. The second one, we have the endometriosis, the growing of uterine tissue for the females. Endometrium, this layer of the tissue covering the uterine. This endometrium, growing two places outside of the uterus. They should growing inside, but they will grow outside, so will have pain in their back. The fibromyalgia, or a chronic pain syndrome involving widespread muscles pain and fatigue. The tumors that press or destroy the bone spine or spinal cord and nerve or outside the spinal elsewhere in the back. What are the risk factors for developing the low back pain? Age, fitness level, weight gain, genetics, job-related, mental health, all of them affecting for developing low back pain. So how we treated the back pain? Acute back pain usually gets better on its own. The acute back pain is usually treated with the medications designed to relieve pain or inflammation. Non-steroidal anti-inflammatory drugs, NSAIDs, maybe it's sold over the country, but if you want to buy this medication, you should take a prescription by the physician. The muscle relaxation are prescription drugs that are used on a short-term basis on relaxed tight muscles. The topical pain relief such as creams, gels, patch, or spray applied to the skin stimulate the nerve in the skin to provide feeling to warm or cold in order to dull the sensation of the pain. Recommendation for keeping one's back healthy: exercise regularly to keep muscles strong and flexible, maintain healthy weight, and eat nutritious diet with sufficient daily intake of calcium and phosphorus and vitamin D to promote newborn growth. The switch sitting position often and periodically walk around the office or gently stretch muscles or relieve tension. Don't try or lift heavy objects. Quiet smoking. Smoking reduces blood flow to the lower spine, which can contribute to the spinal disc degenerative. The smoking also increases the risk of osteoporosis and impedes healing. We finish our video. I hope you enjoy and get benefit from it. Don't do anything from your own. Please go to the special doctor and follow his instruction to be safe. If you like this video, please don't forget to like and subscribe. See you soon. Thanks for watching.